Dear brothers and sisters, Assalamu alaikum wa rahmatullah wa barakatuhu, and good morning. Welcome to the 2025 Medicine, Science, Learning, Innovation, and Mentorship Conference, also known as Muslim 2025. We're excited to have you here with us this morning. My name is Saqib Ali, and I am a member of the Ahmadiyya Muslim Medical Association and serving as Medicine Program Nazim for Muslim 2025. I live between Chicago, Illinois, and Columbus, Ohio. I'm honored to moderate today's panel discussion titled Creating Centers of Excellence in Medicine, part of our broader conference theme, Achieving Excellence through Collective Action and Benefit to Humanity. Let's talk about the structure of the program this morning. We will have 4 speakers, and my co-moderator is Dr. Amina Tariq, who is a board-certified radiologist specializing in body imaging from Northern Kentucky. Dr. Amina has established the teleradiology services at Tahir Heart Institute and Fazl-e-Omar Hospital since 2013. Our session today will focus on various centers of excellence from around the world, their background, what they are doing right now, and how they will continue to grow over the next few years, inshallah. We are going to dive into the significance of Fazl-e-Omar Hospital and discuss short and long-term plans to develop the hospital further. We will also learn about Masroor Eye Institute, which is in Cuba, Burkina Faso, and how it exemplifies the profound impact of dedicated eye care and community well-being. We will explore the inspiring journey of enhancing Ahmadiyya Muslim hospitals and schools, which will shed light on transformative practices observed in Ghana and Nigeria. Finally, we will address the essential need for streamlining workflows and improving efficiencies within hospital settings, which is crucial for delivering high-quality healthcare. Together, all of these themes highlight the interconnection between dedication to medical excellence, community health, operational effectiveness, and setting a pathway for future advancements in healthcare delivery. We are joined by a remarkable panel of speakers who will share their experiences and knowledge in implementing centers of excellence. Each panelist will address their topic pertaining to our session's theme, and after all 4 speakers conclude, we will have a panel discussion and Q&A. I just want to take a moment to thank the organizing committee. It's a group of people that are some of the most humble people I know. So I just want to give them a little bit of recognition before we start. Dr. Nusrat Sharif, who is the Nazim program and president of the Ahmadiyya Women's Science Association, and her Naib Nazim program, Dr. Shanaz Butt. Tasneem Ahmed is the program general secretary, and the rest of the organizing members, Dr. Fizan, Abdullah, Dr. Sohail Hussein, and Junaid Malik Saab, have done an amazing job. Before we begin the program, we will start with recitation of the Holy Quran. I will request Brother Adeel Malik, who is the co-founder and CEO of ClearStep, which is an AI-driven patient navigation company, to come to the stage.
Assalamu alaikum warahmatullah. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. لقد خلقنا الإنسان في كبد أيحسب أن لن يقدر عليه أحد يعقل أهلكت مالا لبدا أيحسب أن لم يره أحد ألم نجعل له عينين ولسانا وشفتين وهديناه النجدين فلقتحم العقبة وما أدراك ما العقبة فك رقبة أو إطعام في يوم ذي مسغبة يتيما ذا مقربة أو مسكينا ذا متربة ثم كان من الذين آمنوا وتوصوا بالصبر وتوصوا بالمرحمة أولئك أصحاب الميمنة.
The verses I just recited were from Surah Al-Balad, verses 5 through 19. The English translation is as follows. In the name of Allah, the most gracious, the most merciful. We have surely created man to toil and struggle. Does he think that no one has power over him? He says, I have spent enormous wealth. Does he think that no one sees him? Have we not given him 2 eyes and a tongue and 2 lips? And we have pointed out to him the 2 highways of good and evil. But he attempted not the steep ascent. And what should make thee know what the steep ascent is? It is the freeing of a slave, or feeding on a day of hunger an orphan near of kin, or a poor man lying in the dust. Then he should have been one of those who believe and exhort one another to perseverance and exhort one another to mercy. These are the people of the right hand.
Jazakallah, Adeel. Our first 2 speakers exemplify the spirit of dedication and passion that defines our Jamaat. They're not only excellent clinicians, but I consider them my role models. Through their stories and experiences, they will motivate us to contribute meaningfully to the world. Our first speaker is Dr. Fizan Abdullah. He is a pediatric surgeon and currently works at Loyola University in Chicago. He has authored over 200 peer-reviewed publications and has received funding from the National Institute of Health and the World Health Organization. His research focuses on minimally invasive techniques in improving global access to surgical care. He is a national leader in pectus excavatum repairs. At the Jamaat level, Dr. Fizan serves as the president of the Ahmadi Muslim Medical Association of the USA. He is also leading the charge for the Fazl-e-Omar Hospital Improvement Project. When he's not operating or doing his Jamaat duties, something on the outside that I think a lot of people don't know is that he's an amazing airplane pilot. It's actually remarkable. So his topic is Fazl-e-Omar Hospital, a center of excellence for medical care. So I will request Dr. Fizan to come to the stage.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Respected Chair, my dear guests and colleagues, Assalamu alaikum wa rahmatullahi wa barakatuhu. It's my great honor and privilege to tell you about the Fazl-e-Omar Hospital strategic planning and listening process that was initiated by beloved Hazur. On October 27th, 2024, our beloved Imam gave a historic address in Islamabad, London, United Kingdom. During that address, he said, "The Medical Association of the Jamaat should consult and proactively engage with relevant officials of the hospital administration and Nazir Sayyid in Rabwa to formulate a comprehensive strategic plan for the short-term and long-term development of Fazl-e-Omar Hospital." Another excerpt from his historic address, he said, "Many Ahmadi doctors themselves have expressed their opinion that the Fazl-e-Omar Hospital should be developed into a state-of-the-art facility. Yet, it is not sufficient to merely suggest this. Rather, as doctors and as a medical association, you should be at the vanguard of translating this exploration into a reality. So you should work diligently on this project and send me your proposals." It was after that historic address that MMA USA, in partnership with medical associations around the world and other colleagues who could support hospital improvement, embarked on the strategic planning process, a 6-step process under the guidance of beloved Hazur and respected Amir Sahib USA was developed, and you can see it on the screen. Step 1 was to form 20 clinical and operational areas for Fazl-e-Omar Hospital with international partners, and we had the great honor and privilege that beloved Hazur himself appointed chairs and vice chairs for each of those 20 teams. Step 2, questionnaires were distributed so we could get an assessment of the current status of the facility. And after our local Rabwa partners filled those questionnaires out, many team meetings occurred where international partners had various discussions to think about the way forward. Step 3, once those discussions about what the plan could be to move forward, one-day departmental meetings occurred where all of the feedback and plans could be discussed in an open and transparent manner. By the grace of Allah, 26 one-day meetings occurred. And step 4, which is where we're at today, those recommendations, and that will be, inshallah, be presented on October 14th through 16th with a hospital-wide meeting. That's step 5. And then step 6, all of these recommendations will be presented to beloved Hazur for his guidance and next steps. This is the strategic planning phase we're currently in, and as I mentioned, this will occur until October, and then it'll be a multi-year implementation plan. There's no question that any plans that will need to be approved will need to be resourced, and specific operational plans would also need to be developed, which would include personnel, equipment, etc. Strategic planning considerations which you received from respected Amir Sahib and beloved Hazur included that all 20 teams have been reminded that the involvement in the Fazl-e-Omar Hospital project is really one of ownership of the project, and in this strategic planning phase where recommendations are being given. But that's not limited to that only. We're asking those same teams to recommit once beloved Hazur's specific approval of the plans is received. The second point is that in areas where there are limitations in human resources or the ability to have center of excellence or areas of expertise for clinical care and no Fazl-e-Omar Hospital staff exists, the teams have been reminded to plan modestly with the intent of participating in Waqf Arzi, perhaps on a rotational basis, to start delivering these services. This is the breakdown that more than 263 volunteers from around the world have said labak to the call of Hazrat Khalifatul Masih, Ayatollah bin Nasr al-Aziz, and you can see the country breakdown. 40% of volunteers, and mostly physicians, nurses, healthcare professionals, including IT and other professionals, have volunteered. 40% are from the US. We have approximately in the high 20% from Germany. You can see Canada in the red, Pakistan in the green, and UK and other countries, with the Middle East, Australia, and India. This is a sample scorecard. We had the great benefit of having some of the members who have been part of the leading healthcare consultancies in the United States, and these were borrowed from some of the best practices that are out there. And this scorecard summarizes those recommendations, and you'll be seeing or hearing about this, if you haven't already, over the next few weeks to months. And this scorecard has the short and long-term plans, as well as the top 5 priorities of each team. We're now in the phase of finalizing the scorecards. You can see we should pray for all of these volunteers. There's literally been thousands of hours of work that have already occurred to try to move all these different clinical and operational areas forward. As you can see, these meetings typically occur on a Saturday morning by Zoom worldwide. We do it at a time when the maximum number of participants from around the globe can participate, and so certainly all are welcome to participate in this process. This is the list of the Fazl-e-Omar Hospital coordinators. We should keep them in our specific prayers. We've been working tirelessly for this project in partnership with our international partners. In conclusion, this was the call to action that since that October 27th address, more than 260 dedicated volunteers have said labak to the call of Khalifatul Masih through the collaborative efforts of Fazl-e-Omar Hospital staff, and we're very grateful to Brigadier Dabir Sab, who is the administrator of Fazl-e-Omar Hospital, and Nazir Said Sab, Mir Mahmood Ahmed Sab, and all of the Rabwa staff who've been absolutely wonderful in terms of their sincerity and the many, many years of hard work that they've done serving the population in Rabwa and the region. So it's a great honor and privilege for us to be working with them as part of this process. So now we have blended 20 clinical and operational teams, and we invite all healthcare professionals and students. We need students to help us carry this forward, to join this blessed initiative and contribute to beloved Hazur's vision of making Fazl-e-Omar Hospital a genuine center of excellence. I'll end with another excerpt of Hazur's address from October 27th, where Hazur said, "I urge all of you to reflect upon this and consider how you can leverage your skills, expertise, and resources to elevate the Fazl-e-Omar Hospital in a way that it becomes a genuine center of excellence. If you can achieve this objective, you will not only impact the lives of countless individuals today, but will also leave a lasting legacy for generations to come, inshallah." Jazakallah.
Jazakallah, Dr. Fizan, for that inspiring talk. Our second speaker is Dr. Ahsan Khan. Dr. Ahsan is a practicing ophthalmologist in Los Angeles, and he specializes in glaucoma and cataract surgery. He formerly served as director of the Gift of Sight program for Humanity First USA and continues to support the initiative as a trusted advisor. Dr. Khan also volunteers with the Masroor Eye Institute in Burkina Faso, contributing his expertise to expand access to quality eye care in underserved communities. He and I have actually been in the same fantasy football league now for 10 years, and I've gotten to know him very well. I've actually been roommates with both Dr. Ahsan and Dr. Fizan in third world countries on HF missions. When Dr. Ahsan is not running to the ORs, he's running marathons. He's actually completed the New York Marathon and the Los Angeles Marathon, and he's training currently for the Chicago Marathon this fall. His topic is Restoring Sight, a Mission for Eye Health Excellence in Burkina Faso. I will request Dr. Ahsan to come to the stage.
Assalamu alaikum warahmatullahi wabarakatuh. A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Respected Chairman Sahib and dear brothers and sisters, I'm grateful for this opportunity to talk about a center of excellence, and we just heard a thorough overview of this beautiful project of Fazl-e-Omar Hospital. And the recurrent theme that we're seeing is the word excellence, center of excellence. And I feel that in Jamaat, excellence and Khilafat go hand in hand. So the recurrent theme that you will see is that when there is the hand of Khilafat, when there is the vision of Hazur Ayadul Talib bin Asr al-Aziz behind these projects, only then can we call them centers of excellence. So just as Fazl-e-Omar Hospital is a center of excellence, in the same way, I wanted to briefly present about the Masroor Eye Institute in Burkina Faso. So to give a little bit of background, blindness is prevalent throughout the world, as you can imagine. And among the leading causes of blindness in the world is cataract. Cataract is an opacification or a cloudiness of the natural human lens. So it's a process of aging, and it's prevalent throughout the world. And the only treatment for cataract is surgery, where you remove it and replace it with an artificial lens. It's the most common surgery performed in the United States. It's readily available in first world countries. But in underserved countries, there is a legitimate need to provide cataract surgery. And there's thousands, millions who are walking around impaired because they don't have access to basic care to remove cataract. Burkina Faso is a landlocked country just north of Ghana in West Africa. It's a sub-Saharan country. It's the hottest country on the planet. And here's a closer up view of Burkina Faso. Its capital is Ouagadougou, which is right in the center. You will see there north of Ouagadougou is a town called Dori. Dori might sound familiar to you. That is where there was a recent shahadat of many Ahmadis at a mosque a few years ago. And that's a couple hundred miles north of Ouagadougou. Burkina Faso means land of honorable people. It was formerly known as Upper Volta. It's a French-speaking country with a population of about 24 million. And the primary religion is Islam. And the Jamaat is well established. We just heard Hazur's address at Jalsa Salana UK, in which he shared the amazing news of nearly 250,000 baths in the USA. And among the leading countries contributing to this number is Burkina Faso, by the grace of Allah. So the vision of Hazrat Khalifatul Masih Ayadul Talib bin Asr al-Aziz was to develop a world-class regional eye care facility providing the highest level of care to local populations, a training facility to enable high-level knowledge transfer to local doctors, and a research organization advancing knowledge. So just to give you a little bit of a perspective, there are 5 ways in which you can contribute to eye surgery in the world from a humanitarian perspective. And by the grace of Allah, the Jamaat has done that in all 5 ways. The first way is that you just donate money. You raise money, and then you deliver that money to an existing infrastructure. For example, there are a couple of doctors, non-Ahmadi local doctors in Burkina Faso. And by the grace of Allah, Humanity First was able to raise money, Humanity First USA in particular, and send that money to these doctors, and then they performed eye surgeries. So that is one way that you can contribute to the humanitarian contribution to eye surgery. The second way you can do it is that you could send teams to underserved areas and perform eye surgery. And by the grace of Allah, we've had the opportunity to do that for about 10 to 12 years in Guatemala. and currently Dr. Asma Bajwa Saiba, who's the head of Gift of Sight, she's been going every year, sometimes twice a year, to do this very thing, to go to Nasser Hospital and to provide eye surgery over there. And so we take teams from the United States and we do that, and UK does that, Canada, other organizations in Pakistan, that happens as well. So that's the second way. The third way is that you can create a mobile eye clinic, which was done as well by Germany, where they actually created a mobile eye clinic and sent it to West Africa, to Benin, and they perform eye surgeries. And there are humanitarian organizations that have planes that travel around the world, and they land in local areas, and the patients go on the plane, and then eye surgeries are performed there. The fourth way is that you can latch on to an existing hospital and just set up an eye clinic over there. And by the grace of Allah, Humanity First and Nasser Hospital have now done that in Guatemala. So there's now a dedicated eye clinic there. And there's not a dedicated eye surgeon yet, but there's an optometrist there. And so that is now happening by the grace of Allah. But the ultimate way to provide eye care in a humanitarian way is the vision of Hazrat Khalifatul Masih, Hazrat Allah bin Nasr al-Aziz, which is from the ground up, on flat ground with nothing there, build an eye hospital. Essentially in the middle of nowhere, where there's no access to eye care, and not only provide eye care over there, but make it a training ground for other doctors to learn how to do surgery, and then do research and contribute to the body of knowledge and research in ophthalmology. So this is a picture of the Misr Eye Institute in Ouagadougou in Burkina Faso. And the visiting doctors were Dr. Mia Khalid Taslim Sahib of Pakistan, Dr. Qasim Mansoor, Dr. Gandhi of the United Kingdom, Dr. Manik. Dr. Imran Masood is spearheading the efforts. He's an ophthalmologist in Birmingham, UK, and he's gone several times, and he's done most of the surgeries that are from visiting doctors in Burkina Faso. And I've had the opportunity now to go twice. So I share this picture because it's sort of like a beautiful example of the spirit of dedication. Sadr Sahib, Dr. Fizan, Abdullah Sahib talked about how we should all volunteer. And I give this example, the picture on my right, so when you're looking on your right, I'm standing next to two gentlemen from Burkina Faso. The one on the left is the former Emir of Burkina Faso, respected Saqib Ahmed Nasser Sahib, who has recently been assigned to Benin. And the picture on the right is his son, Saud Iqbal, who's sitting next to a patient. Saud Iqbal is the one in the glasses. And what's interesting about Saud, sorry, not Saud Iqbal, Saud Ahmed Nasser Sahib. What's interesting about Saud is that he went to medical school and he studied to become a nephrologist, a kidney specialist. And then the instruction from Hazur came to build an eye hospital. And so Saqib Ahmed Nasser Sahib requested Hazur permission to seek Hazur's guidance on what his son should do, because he's already become a nephrologist. And Hazur said to change your specialty into ophthalmology. So here's somebody who had already completed his training. And he went back to school, he got into an ophthalmology residency program, and now he's the director of the Misr Eye Institute by the grace of Allah. So these are pictures of the hospital, and you have to know that in a center of excellence, you have to have the top quality instruments, and the microscopes that are being used at Misr Eye Institute for surgery and the slit lamps that we use are world class. They're the same ones that I use on a regular basis in Los Angeles, and so this has been a work of progress over the last 4 or 5 years to get this equipment. And credit for the building of the hospital goes to Majlis Ansarullah UK. They raised the funds for this, and it was under their direction and leadership that this hospital was built. And so here's a portable slit lamp for a patient right before the operating room. And then I just wanted to give you a glimpse of, I'm not sure if this will play. If we hit play on this, if the IT team can hit play, will it move? I'm not sure. Yeah, it will. So here's a video that I took just with my phone, and I fast forwarded it. And this is us giving a tour of the hospital. So here you walk into the hospital. This will take just about...
इस कमरे में हजरत मिर्ज़ा गुलाम अहमद साहब कादियानी मसीह मौद अलैहिस्सलाम 13 फरवरी सन 1835 ईस्वी में
audio
पैदा
overlap
हुए थे।
happening right now. That's not with the video.
जैसा कि मैंने अभी आपको इसका
So here's the pharmacy we're entering, and you could see the standards of this hospital. how clean it is, how new it is. This is an exam room. There's 3 exam rooms with slit lamp and equipment, and there's patients waiting there. This is where we do the diagnostic checks for the eye, different measurements we do of the eye in preparation for surgery. That is Dr. Imran Saab working with the technician. And so this is one wing of the hospital, and from here we go into the lobby, and on the other side of the hospital is the operating wing. And so here we're going into the operating theater. There's a prep room. This is where patients are prepped and given medications, drops prior to the eye surgery. And here we go into the holding area right before they go into the room, and then these are the operating rooms. And so this gives you an idea of how it looks. We can press play on this. This gives you an idea of how it looks outside. So you're driving here in Ouagadougou, dirt roads, essentially. And then there, as you enter the gates, you see this hospital, which really stands out as sort of like a beacon. And this video is from a couple of years ago. Now there's a school that's been built next to it. There's also a mosque over there. And so this is sort of gives you a picture of what Masroor Eye Institute looks like. And then in 2024, 327 cataract surgeries took place, and so far 319 have taken place through June. And then this is in the lobby of Masroor Eye Institute is a picture of our beloved Hazur, and this was unveiled at the inauguration of the hospital a couple of years ago. So prayers are requested for the efforts here. We have about 7 to 8 ophthalmologists, by the grace of Allah, in the United States, and our hope is that all of them have an opportunity to go to this hospital, just like there's an opportunity for them to go to Fazl-e-Omar Hospital and to Guatemala. So prayers are requested, and then if there's any questions about that during the Q&A, we could take those. Jazakallah.
Jazakallah, Dr. Ahsan. At this point, I'm going to hand it over to my co-moderator, Dr. Amina Tariq, for the final 2 panelists.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillahir Rahmanir Rahim. With the grace of Allah Ta'ala, while still in her early 20s, young Dhiya converted to Islam. Exactly 40 years ago, she took her bayat in Accra, Ghana, under then late missionary in charge, Amir Wahab Adam Sahib, Alhamdulillah. She is a devoted member of Zion Jamaat, the Illinois chapter of Ahmadiyya Muslim community. 30 years of being family nurse practitioner professionally, being highly disciplined and thorough, research-oriented, avid learner, endowed with such God-given, gifted qualities, led her into many leadership roles in the Jamaat, culminating in the most responsible leading role in Jamaat as National Sadr Lajna USA for the last 7 years. She is married with 3 children and has 4 grandchildren. I now welcome our Sadr Sahiba, Dhiya Tahira Bakr, to take to the podium. She is going to talk about shaping the path to excellence in Ahmadiyya Muslim community hospitals and schools, my journey in Ghana and Nigeria.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Jazakallah for that very honorable introduction. Today, my goal is to talk about my journey in Africa as it relates to shaping the path to excellence in the Ahmadiyya Muslim community, hospitals, and schools. We're having a little technical difficulty. So, in achieving excellence and being a member and being a benefit to humanity, we have to first remember our verse from the Holy Quran. And everyone has a goal which dominates him. Vie then with one another in good works, wherever you be. Allah will bring you all together. Surely Allah has the power to do all that he wills. My journey in Ghana and Nigeria started 40 years ago, when I was in my early 20s and not a Muslim. I didn't realize that this travel would lead me on a journey with an opportunity to shape a path to excellence in the Ahmadiyya Muslim community hospitals and schools. I'd like to bring us to the motto of Maslow's hierarchy of needs. Maslow describes this hierarchy as individuals must satisfy 5 basic needs, lower level needs before addressing higher level needs. My focus will be on the physiological, which is survival needs such as food, water, and shelter, and safety needs such as security and protection from physical and emotional harm. Achieving excellence through collective action and benefit to humanity, it is difficult, if at all possible, to reach your potential without first meeting the basic survival needs, such as food, water, and shelter. The IAAE, or the International Association of Ahmadi Architects and Engineers, and Lajna USA, personified this belief by bringing to the village of Sumanatiga, Ghana, West Africa, lighted solar pathways for security and mobility. Here's a picture where you can see the path leading to this remote village and members of Lajna USA entering that village. Now, surprising to us, the National Sadr of Ghana nor the Emir really knew that this village existed until I approached them through the IAAE to visit this remote village. This next slide shows some of the work that IAAE and Lajna, by its contributions, constructed this very, looks basic, but it's very productive water well. You can see myself there testing the well, and believe me, the water came out as pure as it is here in the United States. And then the next slide shows their mosque, where their membership goes for their 5 daily prayers right in their compound. This next slide depicts the safety needs, security and protection from physical and emotional harm. The Ahmadiyya Muslim community in Ghana and Lajna USA Maternity Ward Project. This is a project that Dr. Farida Ducey Wilson, an obstetrician and gynecologist who's the medical officer in charge, presented to me actually 2 years ago at one of your MSLM conferences. I want to describe this hospital compound. It's really a very beautiful compound that sits on, 40 acres surrounded by trees and open space. The total bed capacity is 85 and serves over 16 regions of Ghana and patients from neighboring countries such as Côte d'Ivoire, Burkina Faso, Mali, Nigeria, Niger, Togo, and others. It gave me a feeling of serenity, and I imagine it as a resort for healing. The goal is to increase the bed capacity of the maternity ward from 7 beds, 1 delivery room, 2 washrooms, and a nurse station to 20 beds, consulting rooms, reproductive and child health care units, an antenatal and postnatal unit, nurses' stations, labor rooms, delivery rooms, operating theater, general reception area, and much more. This is all possible from the monetary contributions from Lajna MLA USA when no one else or government would fund it. According to the surveyors, the actual or expected costs would be $205,000. This next slide shows the hospital in Nigeria. It's located right next to the Ahmadiyya Muslim community compound. That hospital has a bed capacity of 40, 88 staff members. It also has the capacity to treat common illnesses such as hypertension, diabetes, cardiovascular accidents, malaria, enteric, and other infectious diseases. Before I go to the next slide, I asked a physician there who was Dr. I'm sorry, I got a note here, says please click pointer to men's side. Oh, that way? Okay. So when asked about this facility's needs, Dr. Sumala, who is the physician in charge for 28 years, he mentions that they have a few basic needs. Can anyone guess what one might be? One is an AED. Can anyone guess what another might be? Another is a mammogram machine. Can anyone guess another one? An X-ray machine. And one more, an echocardiograph machine. Now these are some basic things that we have here in the United States. But when I show you the next slide, you'll see how, in my opinion, old and antiquated this hospital is. Which way? All right, so on this picture, you'll see the young lady with the white lab coat is standing in their radiology room. And I deliberately blurred it so that you can feel what I saw. I don't want to offend anyone, but according to our standards of sanitation and sterility, it didn't have it. So that beautiful hospital that you just saw in Burkina Faso that was funded by the Ansarullah UK, you can imagine this was probably the before. And you can see there's a wooden frame and screen, and that's that X-ray panel. That when we go get our X-rays, it's a nice, fancy, metal, real clean device, where theirs is wooden. And also you can see their machine, which looks very old. And then on the other side of this photo is their laboratory. And it looks just like that, old and dilapidated, basic equipment there. It was kind of heartbreaking to see the condition of this hospital. So now that brings me to some future. Collective work and responsibility. This is a photo of the Lajna USA. We have the Sadr of Ghana, the Sadr of Nigeria, and some of our AMLA members sitting at a round table, exemplifying what we can accomplish working together. In the middle view, you see at the bottom, they're Nazarite students, very poised and welcoming of us. And above that is their fundraising project. The goal there is for them to build this dedicated school for Nazarites, where it would be a place for them to memorize the Holy Quran. And then on the far end is a vast land with a mosque centered there. That land is 500 acres in Akrum, Nigeria. It has a science building and labs, library, dorms, conference room, cafeteria, and the mosque there. This is an international university. And by the grace of Allah, they finally received all their funding. And while I toured their facility, they were very proud, and it was a very auspicious moment. But the future lies in the coming years, where not only the students of Nigeria, but inshallah, other places in that continent and around the world will take advantage of the opportunity to learn here. This is another photo of those students. Okay. Now this motto I pulled off the internet, which I wanted to share because it reminded me about shaping a path to excellence in the Ahmadiyya Muslim community. We require our people to be observant of others and environmental needs, to show compassion, to want to help, and become an active participant, to be fearless when it comes to stepping forward and pursuing a dream, a cause, or a project, and then to commit to the end, and remembering our pledge of allegiance to our Ahmadiyya Muslim community by it, condition number 8. I quote, that he or she shall keep himself or herself occupied in the service of God's creatures for his sake only, and shall endeavor towards the beneficence of mankind to the best of his or her God-given abilities and powers. And as a Muslim, we submit to the will of God. Therefore, man plans and God plans, but God is the best of planners. I'd like to acknowledge our beloved Hazur, who gave me and Lajna and Maila this opportunity, the Jamaat of Ghana and Nigeria for also extending their warm hospitality, IAAE for having the vision and the insight to select this remote village to build the solar lights, water wells, and toilet facilities, and Lajna and Maila USA for their heart and compassion to make that monetary contribution. Now, this is just a simple glimpse into that travel. I hope your questions will come forward so that I can, really give you more of an in-depth view and impression about that journey and what's left to accomplish. Jazakallah.
Jazakallah. Our last speaker in this session is a young healthcare professional who, like so many of us, was organically following in the footsteps of her esteemed father into becoming a medical doctor. When divine guided destiny pivoted her professional life course towards public health, with a concentration in healthcare management. She is currently working as a project manager at Beth Israel Deacon's Medical Center in Boston. Her work focuses on process improvement and streamlining clinical operations within hospital departments. I now welcome Meher Ahmed to the podium to talk about something which is the need of the hour: streamlining and improving efficiencies and workflows in hospital settings. Meher Ahmed.
Auzubillahi minash-shaytanir rajim. Bismillahir-Rahmanir-Rahim. Respected moderators and dear guests, Assalamu alaikum. As Dr. Tariq has so kindly introduced me, my name is Meher Ahmad, and I am a process improvement manager at Beth Israel Deaconess Medical Center in Boston. I'm excited today to talk about the topic of my presentation, which is rewriting the rounds, streamlining workflows, and driving efficiency in hospitals, especially through lean thinking and lean sustainable process improvements. I'd like to begin with the guiding principle from Surah Rahman, chapter 55, verses 7 through 9. And the heaven he has raised high and set up a measure that you may not transgress the measure, so weigh all things in justice and fall not short of the measure. This verse emphasizes the importance of balance, justice, and precision in all things, values that deeply align with our work in process improvement. In healthcare, the measure speaks to data, the accountability, and ensuring we do not fall short or overreach our interventions. To achieve true efficiency, we must see our processes as interlinked as parts of a larger system. It is a powerful reminder that justice in action often starts with measurement and discipline. One of the major challenges in healthcare today is the no-do gap. The space between what we know should be done and what is actually happening today. Despite best practices and evidence-based protocols, breakdowns in execution are common. This gap is due to complex systems, inconsistent processes, or a lack of alignment among teams. Our goal as process improvement project managers is to bridge this gap by equipping staff with systems that work and habits that are sustainable. Similarly, at the bottom graphic, we explore the journey from the current state, which is our baseline with all its inefficiencies, to the ideal state where care is seamless, efficient, and patient-centered. But instead of leaping straight to the ideal, we define a realistic, incremental future state, a crucial lean concept surrounding designing improvements that are practical, measurable, while still ambitious. I've been utilizing the word lean thinking. Many of you must be asking, what is that? Lean thinking helps us focus on value from the patient's perspective while empowering staff to identify and solve problems. We go to the source, which is called the Gemba, or the clinic in many medical professionals' perspective, to see issues firsthand. This is not about top-down mandates, but bottom-up improvements. The two core pillars that guide this work are continuous improvement and respect for people. These are more than philosophies, but are operational strategies we are implementing in everyday work. Engaging teams begins with asking the right questions. What problem are we solving? How do we define it? There are 4 phases in which we do that. We cannot improve what we have not accurately diagnosed. Defining the problem is the clear foundation for everything that follows, from data collection to root cause analysis and solution design. The first phase of that is really scoping the work and understanding what the goals and priorities are. And phase 2 includes 3 different areas. Phase 2, part 1, is understanding the current state of what we're really trying to get at. The first is Gemba ground rules. When we conduct these Gemba walks, we follow key ground rules, which are being respectful, observing without judgment, and focus on understanding the problems, not fixing them. This approach builds trust, uncovers reality of workflows beyond what's visible on reports or charts. There are 8 ways within the lean methodology. The 3 majority that stick out the most are overproduction, waiting, or unnecessary motion. Once we train staff to see these in their own work, we start to unlock improvements. Waste isn't always dramatic, but often hidden in small, repeated inefficiencies that accumulate over time. Process mapping and the spaghetti diagram are tools that help visualize workflows. Process mapping outlines the steps of a task, while spaghetti diagrams tracks the physical movement within the clinic space. Both reveal pain points and redundancies. They're essential in helping our teams recognize their current state before proposing changes. The second bucket of work within current state is measures of improvement. Any type of measurement drives improvement. We ask, what data proves that this is a real problem and not just a perception? Are we using the right metrics? Smart metrics and family measures of framework help us ensure our indicators are specific, actionable, and meaningful. What are the different approaches to measurements? There are smart metrics that help us align our goals and objectives to be specific, measurable, achievable, relevant, and time-focused. The family of measures approach includes outcome processes and balancing measures, while the Pareto charts help us prioritize, showing which problems account for the biggest impact. And once we validate that a problem exists, we shift to understanding why that's happening. Tools like our fishbone diagrams, the 5 whys, and cause mapping help us dig beneath the surface symptoms to uncover systemic root cause. Without this, solutions often are not sustained. I've included an example of a process map which follows the patient's journey from check-in to check-out, documenting very minute processes, which is just confirming a patient is an epic, that a patient is going to imaging to really identify what are the pain points and what are the opportunities that can be identified from that. And from those identified opportunities, we are able to then utilize them in the fishbone diagrams and the root 5 whys that are seen on the slide above to really understand what are the causes of this. Once those are identified, we move into phase 3, which is the target condition and the future state. We want to define now what this process looks like. We use tools like the PIC chart to evaluate ideas based on effort and impact, standard work to ensure consistency, and visual management, which makes processes transparent and easier to follow. And the final is change management strategies to help prepare teams to adopt and sustain improvements. Phase 4 is sustainment, but often the hardest part to do. We use daily management systems, success metrics, and structured communication plans to keep momentum going. Improvement action plans define responsibilities and timelines to avoid backsliding. Finally, we tie it all together. A future state must be patient-focused, eliminate waste, and align resources to meet future demand. It should integrate an increase of quality while at the same time decreasing time, cost, and waste metrics. Most importantly, it is important to remember it should be actionable, not aspirational. Every incremental step helps bring us closer to system-wide transformation. Jazakallah.
Jazakallah. This concludes the speaking portion, and we have now 4 panels available for question and answer session, which will last for about 30 minutes. And following that, we would have parallel session begin at 11 a.m. Jazakallah.
We have 2 microphones up here, so anyone who has questions for our first 2 panelists, please come up to the microphones, and then we'll transition over to the sister side. Okay, I'll start with the first question. This is a question for both Dr. Fizan and Dr. Ahsan Khan. What challenges does Masroor Eye Institute and Fazl-e-Omar Hospital face in maintaining its status of being a center of excellence? And what can we do here as a community in America and outside of Burkina Faso and Pakistan to help maintain this status?
Assalamu alaikum. That's a good question. There are various challenges, as you can imagine, but from my perspective, the biggest challenge for Masroor Eye Institute, and we've heard this from Dr. Abdullah Sab's talk, is getting volunteers to go to these hospitals. Because we have a plethora of Ahmadi physicians in the United States and in Europe, and we need them to go to these underserved areas, go to these hospitals, do clinical work, do surgeries, or whatever expertise they can provide, reading x-rays or running a lab or directing a pharmacy, for example, and then train the locals. That's the key. That's like the biggest challenge, I think, is getting more Ahmadi physicians to not just visit these hospitals, but actually volunteer time there.
Jazakallah for that question. I would agree with Dr. Ahsan that there's no question that human resources is a challenge. I think that these institutions are facing the same challenges that whether they were affiliated with Jamaat or not, any healthcare institutions in a low and middle income country are. That ranges from the most basic access. I really want to reference Sadr Sahiba's chart where we have the most basic things, even for our hospital facilities, everything from water to stable electricity to higher level sort of needs that the hospitals have in terms of availability of facilities, equipment, expertise, beyond just human resources, and training and education. So I think the good news for us, alhamdulillah, as a Ahmadiyya Muslim community is that we really do have expertise from around the world that we can now mobilize and utilize technology to overcome these challenges, inshallah, especially under the leadership of beloved Azur, who's guiding and directing us specifically. So we're all very much blessed with that leadership, and we should pray that Allah lets us rise up to the moment. Jazakallah.
Jazakallah. So to follow up on one of the statements Dr. Ahsan made, that we have a plethora of physicians here in the US and UK. What are some, so Dr. Fizan, you mentioned there's 20 committees for the Fazl-e-Omar Hospital. And I think it might be a good time to talk about a brief overview of some of these committees. So we have so many different fields of medicine represented, so we know what we can volunteer for.
I actually would ask my co-moderator, I would like to hear her comments. She's also Fazl-e-Omar Hospital coordinator, Dr. Amina Tariq, who's been working tirelessly thousands of hours on this just herself, has really done nothing else for the last 6 months. So I'd be interested in hearing her perspective. I think the approach around the Fazl-e-Omar Hospital project is one where there's no question that human resource needs is a primary challenge, and the idea behind the teams is to give responsibility to each of these 20 clinical and operational areas to these teams that are international. Hazura has encouraged us again and again to do Waqf Arzi in person, so that's a major focus, is to get over there. Even for the radiology group has been encouraged to do this in person. By the grace of Allah, 5 or 6 radiologists have been reading the studies for Fazl-e-Omar Hospital and Thayer Heart, including Dr. Amina Tariq, for many, many years now. Nonetheless, to answer your question about the different operational areas, we're really revisiting all of them as part of the strategic planning process. As any major hospital or department, medicine, surgery, pediatrics, radiology, among other major departments are the focus. That goes all the way to pathology and laboratory studies, laboratory department, the blood bank, and every dimension. We're looking at, we have Adeel Malik Sab, who you'll hear from this weekend, and you heard from reciting the Holy Quran this morning. He's the chair of the IT group, so we're rethinking, working with Farooq Sahib, who's the lead for Jamaat's IT infrastructure in Pakistan. So we're really rethinking every dimension of what it takes to have a contemporary healthcare delivery organization and trying to strengthen each and every team and clinical department.
Jazakallah. Please. You can go to the mic. Okay. Dr. Amina, would you like to follow up on Dr. Fizan's introductory comments about the departments? Okay. Okay. Well,
Assalamu alaikum. Yes, we are working, and as Dr. Fazan Abdullah just mentioned, human resources is our biggest challenge, and mobilizing the international partners for specifically Fazl-e-Omar Hospital, but for any hospital, we have to see how we can transfer the skill set on one hand, and how we can also create opportunities for the local people to stand on their shoulders, on their own, not stand on their shoulders, stand on their own feet. So that skill transfer will continue till that happens. So it will be a long process, and we are working on that. Jazakallah. And can I, Dr. Saqib, now transfer any questions from the ladies' side?
no, not yet. In a few minutes.
Oh,
But
okay.
yeah, Dr. Fizan has one comment.
I also wanted to mention that, again, this is beloved Hazur's kindness and grace upon us, that in October 27th, the call to action that he made was certainly, we as AMMA USA said back to it, but we were blessed that day in Islamabad to have many of our AMMA partners from around the world. And I can say it's been a great honor and privilege because of Hazur's guidance. We've been working more closely with our AMMA partners. So I wanted to recognize even some of our presidents have just joined us from around the world. We've got Dr. Coco Bawan from Canada who's come in. So if you could just stand up for a moment so people know who you are. He's a cardiologist, mashallah. And then all the way from Australia with Dr. Adeel Rahman. So please, if you could stand up. He's also a cardiologist. They'll be speaking this weekend. He's our keynote address on Sunday. So we're so grateful that you traveled. And again, been working so many hours with both of them and all of our international partners. You saw that graph that I showed of 260 people, and it's not just U.S. Only 40% of the people are from the U.S. We have a very strong Canadian contingent and Australians and others. So Jazakallah.
Jazakallah.
So just a question on the volunteers and the sort of staff required in those hospitals. Is there possible that some of the work can be done remotely? I understand obviously with eye surgery you need people there, but things like looking at scans and certain types of consultations, could they be done remotely? And is there like a plan to do that sort of work to balance out the heavy requirement of VOC to go for people to go there? Obviously it won't replace, but probably balance a little bit.
Dr. Ahmad, Tariq, if you could address that too, I would appreciate it, because you are doing it virtually. But yes, already by the grace of Allah, there's many departments that are doing virtual care, including psychiatry with U.S. psychiatrists. UK hematologists, oncologists are doing a virtual clinic. We're going to hear from Dr. Amina Tariq, who's doing radiology in their group, again, an international group of radiologists and others. Dr. Amina Tariq, do you want to just make a comment, please?
Ji. Yes, certainly, because we mentioned technology is on our side, so we should use that tool, and it can be utilized in every specialty, definitely. But however, having said that, I as a radiologist, when I was a single person, I used to go to Pakistan and Rabwa every year, multiple times, in order to develop that department, in order to train the technologists, or develop a processes, how we are going to do it. So, it cannot start from the beginning as a telemedicine clinic. It cannot happen like that. Anyone who wants to develop telemedicine path in their each specialty has to sacrifice personal time, travel to the local area or the local hospital, develop connections, develop trust, and then see patients, and then they can easily follow up these services, telemedicine. So it will take time. Like, for example, as it was mentioned, the teleradiology service started in 2013 when in the whole worldwide Jamaat Ahmadiyya, we had the first CT scan installed. So basically, it's a very positive thing that we were able to do, but still there is a local requirement which requires that there should be a local radiologist at the hospital, which we have not been able to fulfill. So we are working towards that goal. So in short, yes, telemedicine is very much in the horizon. It is a possibility, but each specialty has to show leadership by personal engagement first. Jazakallah.
We have one question on the men's side.
Assalamu alaikum. Sorry, this question is a little bit self-serving. Are there critical care medicine services at any of the Jamaat hospitals that are in operation?
That's a great question. I know at Fazl-e-Omar Hospital, we have Mirza Nair Ahmad, who's critical care trained, is surgical critical care trained. There are anesthesia folks that are doing it. I have visited certainly a pediatric ICU, and there is at Tire Heart Institute, of course, a cardiac unit. So there are some critical care services. They may not be as organized in the way that we're sort of used to it, perhaps, in a high-income country, but they exist. By the grace of Allah, also 41 hospitals Jamaat has around the world. I would say that the strongest are institutions, obviously, like in Guatemala, in terms of, not the strongest is not the right word, but a higher level of services are Pakistan, Guatemala, among others.
I would just add that for those of you who haven't had the opportunity to do Waqf-e Arzi as a physician, and what I'm meaning in person, perhaps remotely or consulting, you have, going to Africa, going to Pakistan is very doable, but it's not easy. It requires sacrifice, of course. But one thing you should consider is going to Guatemala, to Nasser Hospital, because it's a 2-3 hour flight. It's a 1-2 hour time zone difference. It's easy to get to. There's really no passport issues. It's safe. You'll be treated by the Jamaat well. Housing is provided. The hospital is state of the art. And then you will get that experience, and you can go for 3 days, you can go for a week. And once you get that taste of this selfless act in the capacity of Waqf-e Arzi, doing it just for the blessings of doing Waqf-e Arzi, that will propel you, that will fuel you to go to other places. And personally, I had gone to Guatemala probably a dozen times over 12 years, and I had a mulaqat with beloved Hazur, and Hazur was asking about, how many cataract surgeries have you done over this many years? And when I shared the number, Hazur's response was, "Aap Africa gaye? Have you been to Africa?" And I said, "No, Hazur." And then Hazur responded, "Phir kya fayda hai?" Then what's the point of what you're doing? And that was a very profound wisdom by Hazur, saying that you've done the easy part. You've gone from LA to Guatemala, it's a 2-hour flight, you've done surgeries, you do that as your day job. What's really the big deal? You should make a stronger effort. You should go somewhere where you're out of your element, you're out of your comfort zone, and you go far. Sadr Sahib, Fizan, Abdullah Sahib has been going to Ghana for years, and now large teams go over there. But it's a stepping stone, and Saqib, Dr. Saqib and I have gone to Guatemala many times. He's gone to Africa as well. That would be a good springboard. So for those, especially those who are in training, that would be a good opportunity, and they do have critical care there as well.
Jazakallah. We will shift over to the sister side for questions.
Assalamu alaikum. So my question is really for all the presenters, and it's a general question that it's amazing how you all have been sacrificing, especially people who go to Africa and face the hardships there. But there's something that's very obvious. It's the maintenance, and it's the skills which are needed from the local population, the trainings which are needed by the local population. So what are we doing to make those places run almost like on auto, where these like hygiene and maintenance of facilities and maintenance of equipment, that is taken care by the locals, and you don't have to send really skilled doctors to go there and find out that things are broken, or like Sadr Sahib mentioned that some of the basic facilities are not there. So what are we doing in that respect?
Just speaking, Assalamu alaikum, just speaking to the experience at the eye hospitals, what you've described is the ultimate goal. That is the key. The key isn't just getting doctors to go over there, because if I don't go, somebody else will. All of us are replaceable. But the holy grail, as they say, of having a center of excellence in an underserved population is for the locals to provide that expertise. And the only way that can happen is if proper training is done. For example, in prior conferences, Dr. Abdullah Sahib has talked about training inguinal hernia repair using mesh, which I'm assuming was a technique that wasn't really well established in Ghana, and now by the grace of Allah it's happening on a more regular basis. So, it's that old adage, you give a man a fish, you feed him for a day, but if you teach a man to fish, then you feed him for a lifetime. And that's why these centers of excellence are more than just places where you treat patients. Hazur has emphasized that they should be training centers, they should be research centers, and it's for that very reason. So the locals who know the language, who know the culture, who have a rapport with the local population, who are from that country, they're the ones who will ultimately run these hospitals. So again, it comes back to Waqf-e Arzi, going there frequently, supervising, observing how things are done, spending the time to teach them how to do surgery, not just have them watch you do surgery, but actually have them do it, and then you supervise and watch. And these things take a long time. It's a marathon, not a sprint. So and that goes with hygiene and with all of the other aspects that improve the standards of care at any health care facility. It requires constantly going there with the aim of having it be self-sufficient.
Dr. Atal, you have a question, please come forward. Dr. Atal from the MMA President Australia.
Assalamualaikum. Actually, I had this discussion with Hazur Anwar in my last meeting about training of doctors in Africa. And first of all, as you mentioned, Hazur mentioned that we should visit them frequently and train them. And I'm talking about it from the cardiology perspective. And Hazur said, what else you want to do? And I said, Hazur, I think if you give them a 1-month relief from Africa and they can go to Rawa to have a training in echocardiology, and they can send us, I can link them with Australia or with Thair Heart. And Hazur said, that's a very good suggestion, and Hazur accepted that. So that's what I'm trying to do. Thank you.
Perhaps I'll just make a comment also on that question. There's no question all of us go through individual journeys, and Ahsan Bhai mentioned our experience in Ghana. By the grace of Allah, I went there first in 2007 with Dr. Agha Shahid Khan, and my approach initially was that I just wanted to go and take care of as many patients as I possibly could. And again, alhamdulillah, many people, including Saqib and others, I had the privilege of going with. And so we just, in the first few years, we just tried to operate our way out of the problem. Literally tried to do as many cases as we possibly could in those few weeks that we were there. But then we realized that over time, we need to really think about systems issues. And then that's where we sort of transitioned to a more train-the-trainer approach. And now, alhamdulillah, we just came back from Ghana about 3-4 weeks ago. We did all we do is we do coursework. We do those same clinical activities, but we're doing them in the context of organized courses. So this year, alhamdulillah, we did a laparoscopic skills course. That's a higher level skills course to teach laparoscopic surgery. It's not for children, it's for adults, adult surgeons. Alhamdulillah, we had surgeons from Ghana, Burkina Faso, Uganda who came in for the course. And that's also focused on operating room nurses, and that's a humanity first organized course. We don't just teach them on simulators, but then we operate on pigs to show them how to do the operation. So really training the local surgeons how to do the cases. This year we also did a ultrasound course using basically the butterfly ultrasound. If you don't know what the butterfly ultrasound is, look it up. It's a handheld ultrasound. It's a really clever device. It comes for about $3,000. It connects straight into your iPhone. And what's amazing is you don't need to have either a tabletop or a self-standing unit that can be $10,000, $50,000, $60,000. So $3,000 for that handheld probe connects to your iPhone, and it has every kind of protocol. It's got from neurosurgery to cardiology to OB to general surgery. And so that from Alhamdulillah, Amir Sahib, Ghana, Muhammad bin Saleh Sahib has been very supportive, and it's understood that's a leapfrog technology for us in the sense that just like cell phones were a leapfrog technology, you didn't need to build landlines, we don't need to buy expensive pieces of equipment, perhaps in our low and middle income country hospitals, and we can use handheld ultrasounds as a point of care technology to really advance diagnostics in those limited resource settings. So last year we did using those same devices. Alhamdulillah, every year we're taking a few devices for our Nusrat Jahan physicians, and then we use those same devices. So last year we did a peripheral nerve block course, so more of an anesthesia course using the same devices. And this year we did more of a trauma course. We actually did a FAST course, so focused abdominal sonographic exam for trauma. So a FAST course using those things. And what was interesting is we've been doing these higher level courses, but then some of the Nusrat Jahan staff and Jamaat members said, listen, this is great, you're bringing these higher level skills, but you're forgetting the staff of the hospital. So then about 3 years ago, alhamdulillah, we started doing CPR as well as first aid training. So this was the third year. We've also been doing that. So we basically go in, we deploy a team of 10, 12 people who are all trainers and experts in different areas, and we run all these different courses. Again, Adeel Malik was our coordinator this year, so very grateful to him and the team of people from many different hospitals who went. Jazakallah.
There's a question on the women's side.
Assalamu alaikum warahmatullahi wabarakatuh. Jazakallah for the wonderful presentations and the discussion. So how important is the knowledge of local culture and customs in treating a patient? And what should visiting physicians do to familiarize themselves with the local culture so they can treat the patients effectively? Jazakallah. This is a question to anyone who's been to Pakistan or Africa, if they can share some light.
Yeah. Sadr Lajna Saiba, or Sister Meher Ahmed, if you've been to a foreign country, if you can answer those questions, then we'll come over here. Okay, so Dr. Fizan, if you can shed some light on her question.
I think the topic of cultural sensitivity and awareness of local custom and culture could not be more important. You cannot go into these countries and say, well, I'm coming from a high-income country and we have this and this best practice. That's a surefire way to alienate your local partners, and the relationship won't go very far. I think it's very important from moment one to have that humility, and the blessing of Jamaat is we have that already as part of our DNA. But to go in, and it's a process of accompaniment and bilateral information exchange, absolutely. I've learned so much in terms of the years that I've been working there. Not to mention, even if you look at the history of the scientific community, there are great innovations that happened in low middle income countries that were brought to high income countries. Oral rehydration solutions is an example, among many others, that were tested in Africa, saved many lives, and now having Pedialyte and oral rehydration solutions in the United States is completely standard, as an example. So I think it requires that sort of humility and process of accompaniment.
I would also request Sadr Sahiba, Sadr Lajna, Dhiya Bakr Sahiba to respond to this question as well.
Jazakallah. Cultural sensitivity is very important. As I mentioned, I had gone to Africa for my first time 40 years ago. And excuse me, even though I'm African American and I'm in a country of African people, they did not see me as a descendant of the African community. Therefore, it's very important that, as Dr. Fazan Abdullah mentioned, that you present a humble approach, but also that you are giving. And I think by the grace of Allah, because we have Jamaat established in these various countries, our work kind of precedes us through their relationships with the natives, so that it's through our bonding with our Ahmadi brothers and sisters in these countries in which we're helping allows us to bond with the extended communities. But again, the most important thing is for us to be humble in our approach, to not come in with our own hidden agendas or even obvious agendas, that we just come there with an open arm and an open heart, and the people will see that more than they'll hear what you're about to provide for them as far as medical care and education and skills and training. Jazakallah.
Any other question from the ladies' side? There's one more question, three more questions.
Assalamu alaikum. Jazakallah for all the presentations, very inspirational. This question is for Sister Dhiya Bakr. Can you explain what the next steps are for the hospital that you visited in Ghana, and how can we find out more information about the ongoing efforts that are going there? Jazakallah.
Assalamu alaikum, Jazakallah. So the next steps in the maternity ward in Ghana is that we have to fulfill our financial obligation. Right now, we're probably a third out in the construction. So as soon as this conference is over, one of my tasks is to go back and send some more financial assistance to them so they can continue the construction. The next thing is, as mentioned by previous speakers, is to motivate individuals here to participate in Walk Viarzi. They are in need of assistance, and it would be a tremendous benefit to them. And right now, I can be the point of contact for the Lajna members there because I've established relationships with their national team. So if anyone's interested, they can always send me an email. But the next step is to finish this maternity ward, and then we work on bringing volunteers from the USA or other places over to assist. Jazakallah.
There's another question.
Assalamu alaikum. Jazakallah for all the excellent presentations this morning. I'm Asma. Dr. Khan, thank you so much for adding my name. That was a pleasant surprise when I walked in. You mentioned my name for Guatemala, Nasser Hospital. So in my question to the panelists is that, as Sister Dhiya Bakr just mentioned, that raising funds is such a huge challenge. So in my learning in the past 2 years since I have been going to Guatemala to build up this eye department, I feel that raising funds through donations is huge to get your goals in time. But at the same time, if you need sustainable health, then I also think that charging the patients who are being served according to their economic and social status is also important. And identifying those patients who are coming to get help from your centers of excellence is a key for the management, the hospital administration. And that's what we have been trying to do in Nasser Hospital, Guatemala as well. So we serve those who are underprivileged and who cannot afford free of charges or minimum $10 or something like that just to register themselves. But patients who come to get help because they all know from the word of mouth that the US physicians and surgeons are coming to help, so they come over to get help. But then the Nasser Hospital administration has been amazing in the last 2 years or so, at least for ophthalmology, that they develop a system of socioeconomic background check, and that way they can charge the amount to the patient according to their socioeconomic status. That being said, it's not 100% working, but I think still it's more sustainable than just relying on donations and fundraising, because that can be exhausting. And then coming to the point of Dr. Khan's presentation, thank you for mentioning that in the last 2 years we have been able to, because we are working on that plan, that's why we are able to have a full-time optometrist in Nasser Hospital. And also now, Dr. Khan, to add to your information, we have a part-time ophthalmologist, Dr. Gilda Rivera, who is a local retina specialist. She has her own practice, but then once a week she's available at Nasser Hospital on a regular basis. And the reason is that we can help her to sustain her by paying her for those services. So that is the key, but my question would be, how do we open our hearts as US physicians and the community we belong to raise more funds through us to sustain Africa, Guatemala, Burkina Faso, Nigeria, Ghana, you name it. It will be hundreds of them, right? So how do we improve our sacrifices to donate? Sister Dhiya.
Assalamu alaikum. So, the first thing that comes to mind to me is, if you don't see something, you don't know about it. So the opportunity to travel is a must, in my opinion, because it opens not only your view of what's happening, but it develops the passion for helping. I can go back to when I became a member of the Ahmadiyya Muslim community, and when I was approached about Chanda, the financial sacrifice, I was really taken aback. I'm like, what is this? This reminds me of Tide at the churches, and I had no clue of where this chanda was going. But it wasn't until I started traveling the world, so to speak, visiting UK and seeing the printing press, visiting Africa, seeing what's going on there, going across the country, looking at what the Jamaat is doing, then I started understanding where my chanda is needed. So unless we try to move people to these, and I'm going to use the word destitute areas, or bring photography or videos to the individuals, then they can't see, what's needed. So I think a visual is very important. And then have people from those particular areas come and speak themselves, share with you what the challenges are, what their dreams are, and what their hopes are. Allow them to express themselves so that we can feel what they're going through and then have that compassion and willingness to make that sacrifice. Then after that, it's between the individual and Allah and their bank account. Jazakallah.
Jazakallah. Given that, Jazakallah to all the panelists for an amazing job. Given the time, we are going to break now. Before we break, I just want to make a quick announcement. We have 3 parallel sessions starting at 11 o'clock. The first parallel session is the future of healthcare, and that will be in Bethesda, these 2 rooms, Bethesda A and B for men, and Bethesda C and D for women. There is a slight change for parallel session 2, which is the biomedical engineering session. For men, it will remain in Rugby, but for our sisters, it will be now in Del Rey. Parallel session room 3 is AI software innovations. The men will now be in Del Rey, and our sisters will be in Auburn. The rooms are actually, when you exit Bethesda A, B, C, and D, the rooms are actually right across the hall, up 1 floor. So you can either take the stairs or the elevator. Jazakallah, everyone, again, for an amazing first session. We'll take a break, and we'll see you at the next session at 11 o'clock.
Assalamu alaikum, everyone. Assalamu alaikum. Assalamu alaikum. We will take the elevator that's on the extreme left-hand side because the men are using that elevator. We'll use this to go upstairs to the 3rd floor. Yes? And then we can guide you because there's been some